Hey everyone, this is Dr. Taylor here. Welcome to my video on functional medicine. I wanted to create this to describe what functional medicine is and why it's becoming such a popular subsection of our healthcare and how it's helping people with chronic illness and chronic disease. First, I'm going to go through some core values of functional medicine. With functional medicine, we're treating the human body and the individual, and we're not treating the chronic disease. We're looking at root cause or causes of the patient's complaint or symptom, and typically those symptoms will just disappear or decrease with treatment once we figure out what those root causes are. The patient-doctor relationship is critical. Lifestyle changes are almost always needed with functional medicine and with chronic disease, chronic illness type patients. A lot of these chronic diseases can be predicted through advanced lab testing. So the dysfunction of the body will always show up before the actual disease or the pathology does. So functional medicine is, like I said, it's become very popular. So it's a completely different paradigm of healthcare than what our conventional or allopathic paradigm is today. So our allopathic or conventional modern medicine is based around acute care and emergency care type situations. So if you're in a trauma or have a severe infection, this is absolutely life-saving, and we have the best system in the world for this. The problem is our biggest struggle with our modern healthcare is the chronic disease, chronic illness type patient. And what we're doing is we're applying an acute care model to this chronic health crisis that we're having, and it's not working out that well and becomes very expensive and very ineffective. Kind of an analogy I like to give on this level is if you're working on a house. So a house has many subcomponents, many different parts to it. You have a plumbing system, electrical system, all your carpentry, the framing, and you have different specialties or people that really know what they're doing to work on these different symptoms or different systems of the house. So say you have an electrical problem, your lights aren't working in your house, and you want to get that fixed. So what do? You usually call an electrician that has all this knowledge base to fix electrical problems. Well, the problem is if you, or think of it like this, if you have an electrical problem and you end up calling a plumber to come out and fix your electrical issues, well, that's not going to work out very well. You need an electrician to work on electrical problems, and you need a plumber to work on a plumbing problem. So the same thing with functional medicine, our current healthcare crisis. When you're looking at chronic health, chronic illness situations, you don't need an acute care emergency type provider. You need someone that's going to work with lifestyle changes and nutrition and really diving deep into why those chronic health issues developed in the first place. So really, functional medicine is just applied biochemistry and physiology. We're just trying to get the body back to a normal state of function. We're just getting things to work optimally and normally. So in doing that, what we end up doing is replacing deficiencies and removing toxicities of the body. So these deficiencies, they can vary, but some of the biggest ones that we look at are amino acid or protein deficiencies, fatty acid deficiencies, maybe a stomach acid deficiency, enzyme deficiency, vitamin and minerals, phytonutrients, maybe you're not exercising enough, and maybe you have poor sleep habits. So these are some deficiencies of the body that we work with a lot of chronic health patients. There's a lot of toxicities in today's environment. So these can range greatly from various pathogens to viruses, chronic stress, mold, fungus, parasites in the GI system, exposure to plastics and heavy metals. We can have food sensitivities, glycemic imbalances, bioenergetics, or sometimes acupuncture. And sometimes we can have just these biomechanical integrity problems, so just like spinal degeneration, neck pain, back pain, that can become toxic to the body. So how do we identify these deficiencies and toxicities? Well, first we just start with a good thorough history. Nothing new here. We do a very comprehensive history intake form. We pull labs from other providers that you've seen. And with that information, we sit down together to go through that physical examination. Components of that are of what you're used to, but then we also add in maybe some Eastern physical examination techniques as well. There's different functional diagnostic testing that we use to address these different deficiencies and toxicities. And here's some of the widely used ones. One is called an organic acid test. We can measure different vitamin mineral levels, bacteria, yeast overgrowth, neurotransmitter levels. We can look at heavy metals in the body, hormone panels, female and male hormone panels, GI stool testing. So we're looking at like enzyme deficiencies, leaky gut markers, your mucosal integrity, candida or yeast, parasites, and bacterial dysbiosis. We can look at food sensitivity testing, adrenal testing, and for some genetic testing. And we use these to uncover these toxicities and deficiencies of the body. So again, we're just trying to optimize physiology and biochemistry. And we use lifestyle modification, nutrition, herbal therapies to address these different issues and to help rebuild the body. And the biggest question with functional medicine is why are you having that symptom? So a good example is polyarthralgia, or just joints throughout, or pain in different joints throughout the body. And you can use a lot of synthetic and natural therapies to just mask the symptoms. But the question is, why do you have that symptom? Do you have a heavy metal exposure? Do you have a mineral deficiency? Is it just chronic mental stress? Is it leaky gut, food sensitivities, structural issues within the body? So we have to look at all these and really figure out why that is occurring instead of just trying to take a supplement or a medication to try and mask those symptoms. So Dr. Osler, he said it best. He was one of the founders of Johns Hopkins Medical School. He said, if you listen closely to the patient, they will tell you the diagnosis, so a great thorough history. A physician treats the disease while a great physician treats the patient who has the disease. So that's what we were talking about before, just a great patient-doctor relationship and trying to really uncover some of these issues within the body. So I'd like to go over the kind of the broad, 20,000-foot view of functional medicine. So this first row that we have, this mechanical trauma, infectious toxicology, nutrient imbalances, all of that is basically your environment and lifestyle choices. And what happens is these different lifestyle environmental influences impact the body, and our body will respond, and we call this allostasis. So allostasis is basically just how the body adapts to different stressors within the body and to the environment on the outside. And there's really three main systems that the body has to adapt to these different stresses. The first one is just your hormone system. The second one is your nervous system. And the third one is your immune system. And basically, when we have these different environmental and lifestyle choices, the body is going to respond. And then if you have certain genetic susceptibilities, we call this epigenetics, you're going to end up developing different symptoms. So for some, you may end up with weight gain. Others are thyroid issues, gut issues. People may have anxiety or ADD, ADHD, different autoimmune diseases, joint pain, decreased libido, and the list goes on and on and on. So with functional medicine, we start from the top. We start with lifestyle and nutrition, and we try to figure out what's going on with the patient to why the body is responding the way it is. So for example, someone may have like Crohn's disease. They have this immune system that's gone haywire in the GI system. So in conventional medicine, basically what they do is just suppress the immune system. They don't look at the underlying root cause issues of why that those symptoms are manifesting, and they would just prescribe a immune suppressing drug. Whereas with functional medicine, we say, okay, the immune system's gone haywire, but why? Why is the immune system doing that? So we look at different things like infections, toxicology, what nutrient imbalances do they have, what are you eating, what's your stress levels like, and we address those first. And then we may also address the immune system or address the GI system to help rebuild and get it functioning normally again. And then when you do that, that top-bottom approach, then your symptoms on the very bottom, for example, like IBS or Crohn's, then the symptoms begin to disappear. So we have a couple of next steps for you to get you feeling your best. The first one is a free 30-day program that I put together. I call it 30 and 30. So it's one health action step per day for 30 days. And I guarantee you, if you apply these basic principles to your daily life, then you're going to have better health outcomes and you're going to already start feeling better. So I have a link there. Feel free to go there, register for that, and start getting those health tips today. And you can start reversing some of your health issues today. So the second option is becoming a functional medicine patient. You can click the link there and basically fill out your consultation request. And what we do is a free 15-minute consultation, and we just kind of go over your goals and where you've been and what you're wanting to accomplish with functional medicine to see if this program is right for you. It's not for everybody, so that's why we do the 15-minute free consultation, and it's required before starting functional medicine to make sure this is right for you. So you can sign up there and send that request over to us, and we'll be giving you a call. Thank you. I hope you enjoyed this brief description of functional medicine. Be sure to follow us, like us, share us, and we'll be talking to you soon. Thank you.